Then for the state perspective, I'd like to introduce Commissioner Arlene Gonzalez Sanchez, a Hunter graduate from the School of Social Work, Commissioner of the New York State Office of Alcoholism and Substance Abuse Services, and she'll be followed by Councilwoman Rosie Mendez.
I can't say that I'm challenged because I'm short because now it's on the table. Well, good morning. I'm really, truly very happy to be here today at one of my alma mater, even though I'm a Rosedale graduate, but I am a graduate from Fordham as well. I am grateful for the invitation from both Maria Elena Gerone, co-chair of the Latino Social Work Task Force, and the president and CEO of the Puerto Rican Family Institute, and Dr. Robert Schechter, co-chair of the Latino Social Work Task Force, and executive director of the New York City chapter for the National Association of Social Workers. I would also like to acknowledge Dr. Peter Vaughn, Dean of Fordham University Graduate School of Social Science, the Latino Social Work Task Force members, fellow presenters, panelists, elected officials, and VIPs, and everyone for being here. I know I left a whole bunch of deans out, but I'll never finish, and I know we're a little pressed for time. I've been invited here today to speak about the challenges we face today in the Latino community, in the substance use disorder field, and in the rapidly changing world of healthcare reform. And while it is my intention to speak of the challenges, it is equally important to talk about the opportunities, because never before has the substance use field been in such a unique position to utilize our expertise and realign our priorities in a way that puts us in the driver's seat. Just having mental health treatment training does not make one competent to treat addiction. By this time, I'm sure that you all have heard about the dramatic changes that lie ahead with the passage of the Affordable Health Care Act. For those who believe that this might spell the end of this field as we know it, let me just say this. It is only the beginning of a new day. A day that will bring us new opportunities to show how effective treatment is and how essential it is to integrate substance abuse treatment with the full continuum of health and primary care services that our population needs and deserves. More than ever before, our programs and our workforce need to focus their attention on the full continuum of services, finding the appropriate fit for substance use disorder treatment and other behavioral health care within the primary health world is probably the most important task before us. Successfully coordinated and integrated prevention, treatment, and recovery services will not only improve outcomes for behavioral health clients, but will reduce costs statewide and nationally. In his State of the State message earlier this year, Governor Andrew Cuomo outlined his plan for transforming New York State and to make better use of our limited resources. I firmly believe that this is the path the behavioral health system must follow as well. One thing is certain. We cannot continue as we have in the past. Our system is fragmented. Our clients are falling through the cracks, and the cost of their care continues to go up. So, what do we need to do? We need to develop a seamless continuum of health care that includes primary health, prevention, treatment and recovery supports, as well as mental health services. We must examine service delivery models that provide integration with primary health care. We can no longer focus only on that part of a person's behavior that we call an addictive disorder. Our clients are whole people. Let's treat them that way. I am reminded of a case involving a 35-year-old Latino male who, in addition to a 19-year history of alcohol and heroin use, was diagnosed with hepatitis how to see.
Yeah, I know how to.
And he's lucky he was diagnosed.
Right.
This patient bounced from
Just
clinic
that
to
hand, I
clinic,
think you can-
residential
No,
to
this is the
outpatient,
moving,
never
trying
getting
to shift it
sufficient
downward.
medication attention for his health needs. His cost to the Medicaid system over several years exceeded $350,000, while providing no assurance that his life would stabilize or his behavior would change in any significant way. What he lacked was a care coordinator who could make sure that his multiple health needs were being addressed and managed in an integrated, person-centered, and cost-effective way. It's time to break down the barriers that get in the way of truly integrated healthcare. Among the many ways that healthcare reform might affect our system, one is certain. It will focus substance abuse service providers to be more accountable, to change our collective focus from one in which New York State funds deficits to one in which we pay for patient outcomes. That is one of the key underlying themes of Governor Cuomo's charge to the newly established Medicaid redesign team, better known as the MRT team. The MRT, which I am proud to be part of, is charged with finding ways to reduce costs and increase quality and efficiency to the statewide Medicaid program. After an initial round of meetings, the MRT submitted a report to the governor that contained 79 recommendations to redesign and restructure the Medicaid program. In a report released on October 5th,
Yeah, what I'll do is I'll leave this.
we were pleased to announce that a $600 million savings was achieved in the first 6 months of the plan's first phase, while Medicaid enrollment continued to increase through August. The success of the MRT plan is expanding coverage while containing cost, is a clear demonstration of how New York State can provide more effectively managed health care. One of the key enacted MRT recommendations gave OASIS and OMH the authority to carve out our services from the commercial managed care and jointly select and contract for the services of regional administrative service organizations, which we refer to as behavioral health organizations or BHOs. These BHOs will not function as commercial managed care entities as we have grown to know them. BHOs will provide administrative and management services for the purposes of coordinating the provision of behavioral health and other services available under Medicaid programs. The regional BHOs will conduct concurrent reviews as well as assist in discharge planning for fee-for-services, inpatient mental health services, and inpatient substance use disorder detox and rehabilitation services. Another major MRT initiative that is moving forward is the establishment of health homes, the whole health home concept. A health home may be a single organization or a network of agencies that offer comprehensive case management, coordinated and health promotion, ensuring appropriate transitional care from inpatient to other settings, including community-based and other social supports. While the State Department of Health serves in a lead capacity on the establishment of Health Home Network in New York State, OASIS is fully engaged with DOH to ensure that adequate representation from the OASIS provider community is present. Early indicators are very favorable that DOH will support OASIS recommendations, not only for the types of services to be made available, but also for the qualifications of staff who provide these services. It has also been my privilege to serve as the chair of the Medicaid Redesign Team's Health Disparities Work Group, which is charged with examining health disparities among people with disabilities, including people with psychiatric disabilities and substance use disorders, and their need for equal access to primary and preventive health care services. The work group has been exploring issues related to charity care, and the uninsured, and has benefited greatly from having a consumer of Medicaid services participate as an active member of the team. We know that individuals of color are disproportionately represented in Medicaid population. While 40% of the state's population consists of people of color, 68% of the state's Medicaid population fall in the same racial ethnic category. Due to these statistical disparities, the work group came up with several proposals. Let me just highlight two. I can't sit here and highlight all of them. First and foremost is to authorize Medicaid reimbursement for language assistance services. In our state, there are more than 2.3 million New Yorkers who are limited English proficient. They have a right to health care in a language they understand. To accomplish this, we have recommended that adjustments be made in the rates of payment to cover the cost of interpretation services for patients with limited English proficiency and communication services for people who are deaf and hard of hearing. In light of this recommendation, we were very pleased to see Governor Cuomo issue an executive order on October 6th to improve access to state services for non-English speakers. This executive order requires state agencies that provide direct public service to offer free interpretation and translation services to members of the public for vital forms and instruction in 6 other languages, such as Spanish, Chinese, Italian, Russian, French, and French Creole. Providers covered by the order will need to reallocate resources to ensure compliance. The second recommendation from the Health Disparity Work Group is making prescription medication labels and information accessible. To ensure that all patients across our state can receive prescription drug information and counseling in a language they understand, the work group recommended that the Public Health and Education Law be amended to require the State Board of Pharmacy to create standardized prescription label instructions. Mandate that chain pharmacies and mail-order pharmacies provide translation and interpretation services for limited English proficient patients, and that the prescription pad be modified to allow prescribers to indicate if a patient is limited in English proficiency.
Perdón, un minuto.
Okay, so, let me go to the nitty-gritty. Okay, so now, while I have the opportunity, I'd also like to speak to an important issue on the horizon that is of interest to the Latino Social Work Task Force and OASIS. The year 2002 was important for the profession of social work, since that is when the state legislature passed legislation creating the licensed clinical social work and the MSW. I think everyone here will agree that this was one of the most important advances for the social work profession here in New York. For OASIS, this legislation was also important because it acknowledged the role of credentialed alcohol substance abuse counselors, or CASACs, by granting them a permanent exemption from those provisions of the law which restricted unlicensed persons from performing certain professional functions. The bottom line is that the sunset will be July 1st, 2013. We have a lot of work to do. We personally, the department has submitted to the New York State Education Department a plan. The plan, the report is not public, but in essence, it articulates our concerns about the potential impact of the sunset of the legislature exemption, both in terms of cost and disruption to the existing provider workforce. The report also offers concrete recommendations for how OASIS will prepare for the sunset. Among these are promulgation of counselors, scopes of practices in OASIS regulations, broader acknowledgement of the multidisciplinary team model, which will allow unlicensed personnel to assist in the delivery of services or to recommend treatment options which might require direct supervision or sign-off by a licensed practitioner. And statutory amendment to the education law to expand the permanent exemption to other OASIS credential professionals. I believe my minute is up, so I will end there.
No.
All I really want to say is that this is an extremely important forum. I look forward to working with all of you. I am going to need your support in these next coming years with all the different challenges and opportunities that we have, and I really look forward to working with you. Thank you.
We're sorry the commissioner has to leave, she has to catch a train, but if we have any questions for you, we'll make sure you hear them.
Absolutely. I was going to say that. Please make sure you send it to me and I will respond.
All right. Thank you, Commissioner. And now for a consumer perspective from Council Member Rosie Mendez.
Good morning. How are we doing today? Okay, not enough coffee, it seems. I don't think that was Gustavo either. I don't know. So I'm not a social worker, but I was a legal services lawyer, which means that I did social work in the courtroom. So I represent Council District 2 in Manhattan. I'll tell you a little bit about my district so we can put it in perspective. My district is the low-income and now gentrifying community of the Lower East Side, the East Village, which I still call the Lower East Side, Gramercy Park, where they have a private parkway key, and if you live around there, you can get into that park. I don't know if you live there. Yeah, Julia Roberts is one of my constituents. Murray Hill, Rose Hill, and Kips Bay. So it's a very economically diverse and ethnically diverse district. And so it is 60% white, and in fact, that was the same demographic when my predecessor, Margarita Lopez, was elected. So it's still kind of astonishing to me when I send out my newsletter and I get a couple of phone calls, people saying English only for my newsletter. Or when I write about, since I'm an out lesbian, when I write something about marriage equality or something, that I get a couple of people wanting to be removed because I'm doing work in gay rights. So I think that has to do a little bit with the fact that our community has gentrified so much, and all these new people moving in who don't know my history and doesn't know our community struggles. And part of me being in office, and Margarita Lopez being in office, was actually part of a community struggle. We were community activists, and we wanted to take back our community, and we were doing it as activists, and we figured it was necessary to expand that to other roles, including the electoral process. So it's something that we struggle with every day in our office. How do we provide services to our constituents who are very diverse? And how do we provide multilingual, culturally competent services to them? So I have a growing Asian community, and I'm not doing very well learning my, not just Mandarin, but Cantonese. I've learned like 10 words and then I forget like 5. But it's something that I feel is necessary and I have to do to try to communicate on even a small level with all of my constituents. What I do as a legislator and what I've done because I'm an activist who works for a council member who is an activist is I don't work by myself. I work in coalitions with groups, and most of the time when we are talking about either legislation, a social policy that could be developed into legislation or into a budgetary item, it's a bunch of advocates sitting at the table with me or my staff trying to figure out what's the best venue of getting funding for this issue or getting legislation passed. And in the Lower East Side, before we were elected to office, it was this diverse coalition of white, Asian, Latino, African American working together looking at how we could preserve our community. So in the Lower East Side was where the homesteader movement to take back empty city-owned buildings and make them affordable housing started. It was where empty lots were taken to remove debris and create open spaces known as community gardens. It was where one of the first recycling programs was made, which got expanded to be a bigger performance community garden now. And it was where, during the 1970s, how many people remember the 1970s in New York City? Okay. I'm a native New Yorker, so people don't get it, but the 1970s in the Lower East Side, which was called Alphabet City, and that was a derogatory term. Now apparently it's back, and it's like, all the models call it Alphabet City, like it's a new terminology, and they don't get the history of it, right? So that was where the city instituted Operation Pressure Point, because of all the drug dealing that was going on. And it is where the one bank, Manufacturers Hanover, was closing down because Operation Pressure Point was actually putting the bank out of business because the only one depositing money was the drug dealers. And the community was going to be left without a financial institution. So it was the residents of the community, people like Margarita Lopez, my former chief of staff, Lisa Kaplan, who came together and started researching and decided to build a credit union. And it's going to be 25 years we have that credit union. And it is bilingual, it's actually trilingual. And it provides affordable financial banking services to our community. I sat on that board, and certainly with everything that's going on with Occupy Wall Street, I think we need to really start a movement about having more financial institutions by the community and for the community. So it was through those movements that we then went to legislators to put the funding in place to fund homesteading programs and allow tenants to buy their own buildings and become limited equity cooperatives. It was with the assistance of, one of my predecessors, if we can figure that one out, Marion Freelander, who was the first woman to help act up, get into City Hall and stage a protest, and provide resources for domestic violence victims for our poor communities. And from there, we kept building on it. And some of it was passed on as law, and some of it was passed through finding the monetary resources for it. So one of the things I have worked on in the City Council that I'm proud of is helping the Latino Social Work Task Force get funding to expand its programs and to get more BSWs to go back to school and become MSWs. And it should be in a better... And we should be in a better place right now with that initiative, but because of the economic climate, it's been hard to try to fund everything because we've been making cuts to everything. So to try to wrap this up, just to say we need your help. So like currently I just